People who have an acute narrow angle glaucoma attack, within 24 hours, they lose vision if they don't get help. I'm Dr. Jane Hughes. I'm an ophthalmologist and an ophthalmic surgeon from San Antonio, Texas, and this is my second opinion. What I've seen with my practice, of course, was initially there was a huge drop in volume. I kept my practice open in spite of some of the recommendations by national organizations, because if you can't, as a physician, provide a safe environment for your patients, I don't know who else can when people are going to the grocery store and Walmart. My patients who did come had serious problems and were so thankful that I was available to see them. I had a cardiologist patient come in who was devastated. One of his patients needed a stress test and was so afraid of COVID, he didn't come in, and he died of a heart attack at home. We have stories of individuals who've had strokes where they could have had the clot dissolved, who had permanent disability. People who have an acute narrow angle glaucoma attack, within 24 hours, they lose vision if they don't get help. Fortunately, in my practice, I didn't see it, but I did hear from the glaucoma and from the retina specialists that they saw people delaying treatment with very adverse effects. In my own practice, I had to literally talk someone off the ledge, if you will, who was having symptoms of retinal detachment, and he was so worried about the virus that I spent a good 20 minutes telling him he had to come in, that we had a safe environment. Fortunately, we caught it at a time where intervention was successful. The other aspect of this, though, and people don't really think about this, is the devastation to the medical community and our resources in and of itself from the lockdown. Many physicians closed their doors on recommendation of the CDC and some of the national organizations. And the problem is we were at risk of not having a healthcare system to come back to. There are hospitals that have been empty, literally. Their offices where they have generated no revenue have let people go. I fortunately did not let any of my people go, even though we saw very few people, 1/6 of my volume for probably 4 or 5 weeks, and no surgery for 6 weeks. Our surgery center was struggling not to let our nurses and techs go. We were fortunate in that we had some cash buffer, but we were having to draw on that. So there were two devastating things: the comorbidities that didn't have anything to do with COVID that got put on the back burner, breast biopsies, colonoscopies, little kids' vaccinations, and offices that literally were at risk of going under, some of which did.